Oh, hi. Hi.
Okay, my name is Missy Gallo. I'm an orthopedic physical therapist. I've been treating for about 6 years now. Graduated from the University of Dayton, and I work at Active Physical Therapy. I've been there now for about 3 years.
Hi, I'm Maria Baldino. I'm a Pediatric Occupational Therapist. I've been practicing in pediatrics for about 3 years. I started my career in Boston working in early intervention and private practice, and then moved out to Columbus to do a pediatric fellowship at Nationwide Children's Hospital. I currently teach on the faculty at Ohio State University and treat at Nationwide Children's.
So we decided to develop a workshop for mothers in the fourth trimester. The fourth trimester basically means those initial 3 to 6 months postpartum. We kind of feel like there's a lot lacking in that time frame for new moms in terms of what they can access for themselves and for their baby. So we decided to collaborate and develop kind of a community group for moms to go to and get all of their information in one setting from 2 healthcare professionals that have knowledge on postpartum health and baby health in that fourth trimester.
You know, our goal together collaboratively is to increase the confidence and confidence of new parents around caring for their baby and getting their lives back.
She wants to help with this baby development in that fourth trimester, and then I want to help with the mom in that fourth trimester. So we really wanted to come together so that we can provide a resource where we can work on things for the mom, getting your core strong again, kind of reconnecting that mind-body connection, and also providing resources for your baby all in one setting. So we kind of wanted to make it more of a standard of care that you see a physical therapist postpartum, even if you're not having any issues, any pain, any incontinence, anything, but just to kind of get cleared to kind of go back and start your life. Because even if you're not trying to get back to exercising or fitness necessarily, caring for a child is fitness. I mean, you are lifting, you are moving, you are going in awkward positions, and everything you do with your child as they grow. I mean, children want to be carried till they're 3 and 4 years old. That can be up to 35, 40 pounds.
When people have a baby, they are flooded with information, right? That your baby should be holding their head up a certain way by 3 months. They should be able to do tummy time to such a way by 6 months.
There's all these standards.
There's so many developmental milestones, and I think it's important for people to know that every child is kind of on their own journey, and that even though your child maybe really doesn't like tummy time, there are ways for us to help them enjoy it, right? So there are ways for me as the occupational therapist to help you adapt your environment, maybe adapt your daily routine, or even work this into your daily routine.
Yeah, I think as a mom myself, a lot of what you do is you just Google things. So I would be like, oh my God, one of my children's head is getting flat. That must mean they're laying on their back too much. I'm gonna Google it because I don't know what else to do. So having a resource like Maria, it would be so great for just those little things day to day that you're not sure what to do with your baby. I mean, your baby's only entertained for about 10 or 15 minutes, and then you have to change. So you have to constantly be changing your activities, your playtime, what to do, and it can be hard to get creative if you really you don't know what you're doing.
Working with an occupational therapist could be as simple as me giving you the knowledge of how to set up the baby's room so it promotes them to look a certain way, or how to hold your baby, or how to engage in certain toys with your baby, or engage in play to help them kind of break that pattern.
We're hoping to start our first group with new moms with children ages 6 weeks to 6 months of age. That is the kind of the target group that we're looking at right now, is that first fourth trimester care. Not to say that the information we're going to provide is not helpful for beyond 6 months, but that's where we're going to start. And then the goal is that we develop this into other age groups as well, 6 to 12 months, toddler age, because this group is meant to bring your child with you and interact together with you and the baby.
This group kind of came from this conceptual model, right, where for a baby to meet all their needs, they need to have a caregiver that's there for them, right, and feeling really good about themselves. And we know from literature that if a mom, her physical health is declining, or she doesn't feel like herself anymore, it could also impact her mental health, which could impact how she interacts with her baby. And ultimately, we want to have that really nice, strong connection to help baby grow and develop and engage in activities with mom.